My name is Dr. Mary Clark, and I currently serve as the Assistant Dean in Student Affairs at the Eugene Applebaum College of Pharmacy and Health Sciences. A little bit about my background and how I arrived at this position in life. I am from a small rural community, Millington, Michigan, which is just north of Flint, Michigan. And I arrived there because my father's family moved there in the mid 1920s, and they were the first Black family to move into Millington. My grandfather purchased a 120-acre farm, which they raised cattle, and they had a dairy farm business there. So they produced milk that was sold to the local dairy in the 1920s, in addition to my grandfather and my father and four uncles. They worked in the factory as well as worked on the farm. My father bought a 40-acre farm about a mile up the road from where he grew up. And so that's where I spent all of my years until I was 17 years old and left for college. My experience growing up was that I was typically the only Black child in my grade from kindergarten through 12th grade. I was the only Black person in my graduating class. So I've been accustomed to being the only all of my life. And what it has allowed me to do is view the world through a variety of lenses. So I interact very freely and fun and openly with my family, realizing that when I move into a world of others, that there's a different way that I perhaps have to talk or act or engage. And so that's been part of my repertoire all of my life. I got my undergraduate degree at Bowling Green State University in Toledo. So my master's degree is from Wayne State, and it's in community and agency counseling in the College of Education. At the time, I was working full-time in a career that was not satisfying. It was the career that I had gone to my undergraduate degree for, which was retail management and merchandising. I was a retail store manager at a local mall, and I needed more. So that's what led me to Wayne State. Wayne State was very close to where I lived in the Boston Edison district, and Wayne State was close to where I worked at Northland Mall. So I would work full-time and fit in classes part-time as I was able to do that. So it took me a little bit longer to finish my master's, but finish I did. What that also gave me was the understanding of how many of our students have to juggle and balance work and other responsibilities with their school life, which I have always been aware of, but I got my own firsthand experience as I got my master's degree. This position as the Assistant Dean in the College of Pharmacy and Health Sciences broadened my responsibilities, and I was looking forward to working at my alma mater, and it has been a wonderful experience. In the Office of Student Affairs, every day it's almost like arriving at a new job because there's never a same day repeated. Each day we interact with different students, we interact with different situations, we have to solve different problems. It's totally unpredictable. So I enjoy the fluid nature of figuring out what can be done to solve whatever problems are brought to our door. There's always an opportunity for an emergent situation that has to take high priority. And many of the things that the Office of Student Affairs handles are confidential matters. And so a lot of the work that's conducted within the Student Affairs Office is totally unbeknownst to anyone else other than the people that it's impacting. That in itself is something that we don't take lightly. Something that I learned about myself many years ago in one of my counseling classes was this term locus of control. And it's actually a social learning theory, and it's based on health behaviors. In learning more about the theory, I learned that it's also helpful in determining how I handle things. Locus of control is simply what actions you take to manage situations. Do you manage them internally, or do you blame outside environmental or other sources or people for how things are handled or managed? And the value of being a person that operates with an internal locus of control is that you take responsibility for situations. You take responsibility not only for the situation, but for the solution. And you feel more in control of the outcome. What I've learned also, because I have had a career in counseling too, it was easy to see the clients that I worked with that had an internal locus of control as opposed to an external. Internally, those clients would want to begin kind of plotting out next strategies for success, or what they need to do in order to improve their health, what steps need to be taken, who they can work with to involve their healthy behavior or their health improvement, as opposed to clients who did not want to take responsibility and instead lay responsibility on, the boss that they had, or the doctor that gave them the wrong diagnosis, or that they didn't have enough resources to buy the things that they needed in order to recover. All of those external things are, to me, just an excuse, because if you own your stuff, if you own your situation, if you own your actions that landed you where you are, then you have that same ability to take control to make things differently. And so my advice to anyone is own your stuff, own the responsibility you have to be successful, whether it be in your academic endeavors, whether it be in your career choices, whether it be in your personal choices to choose the right person to spend time with. If you expect someone else to have the same dedication to you to make your life easy, that's going to be a difficult road for you to travel. I've been asked to share one challenge that I faced as a Black woman in my position or throughout my life. And frankly, there isn't enough time, and I don't have the energy to relive those situations. What I will share with you is that the lessons that I've learned from what others demonstrate when they see me walk into the room, or when they respond to something that I've said, or when my answer is repeated by someone 10 minutes later, and it's accepted as the greatest answer that has ever been shared. Those are the kind of experiences that I've had too many times to spend my life recouping and reliving. The biggest challenge to me is not believing somebody else's opinion of me, and letting that minimize who I am. I think what I've been fortunate to have were parents who grew up in very similar situations, that I watched and saw how they handled delicate situations. And they weren't bitter. They didn't spend a lot of time trying to prove who they were or change someone else's mind. They just kept on living. And for me, that has worked. So instead of sharing a challenge with you, I offer you a suggestion. If you have an opportunity in a conversation when someone is saying or doing something that you deem inappropriate. And instead of having the person who their words are impacting have to defend themselves, you speak up. Because frankly, as a Black woman, I get tired of having to defend myself. And so many times I just walk away. So be an ally. That's my challenge to you. Be an ally and speak up.